Okay, Bismillahirrahmanirrahim. Today we are going to discuss about the vertebrae. There are total 7 vertebrae in all. This one is the C1 is atlas and C2 is the axis. Okay, and C7 vertebrae is also known as atypical vertebrae in few books because of the difference of the spinous process. You can see the difference in the spinous process of the both vertebrae. This is a typical vertebrae. For a typical vertebrae, there are some things that need to be required or that should be present in the typical vertebrae. In typical vertebrae, okay, these things are there should be a body and there should be a spinous process. There should be a spinous process present over here. And now we are going to talk about the C1 and C2 vertebrae. For C1, this one is the C1 vertebrae and this is the C2 vertebrae. How you are going to identify the C1 vertebrae? C1 vertebrae is there is no body, rather lateral mass is present over here. This is the anterior arch, this is the posterior arch. Anterior arch, okay, this is the anterior arch and this is the posterior arch. Anterior arch is shorter and posterior arch is circular and longer. This is the anterior tubercle and this is the posterior tubercle, okay, and this is the facet for the odontoid process of the C2 or axis vertebrae. Now how I am going to identify that with this one is the superior part and which one is the inferior part? Superior articular facet is basically concavity. There is a concavity so that the occipital condyle lies over here or it forms the atlanto-occipital joint, okay, and this is the inferior articular facet and it is flat in nature, okay. Now there are certain parts of the vertebrae, these are the pedicle and rather body. There is a lateral mass present over here and there is the anterior root, this is posterior root and this is the costotransverse bar or this is the foramen transversarium. I am going to show it you in a different vertebrae in which you can see it in a better way, okay. And this is the foramen transversarium, anterior root, posterior root, costotransverse bar. Together they are forming foramen transversarium or transverse foramen. And pedicle, these two are pedicles and two laminas are forming spinous process. But in C1 there is no spinous process present over here, rather posterior tubercle is present, okay. This is the vertebral column. In the vertebral column there is a spinal cord is present and epidural space is present, dura mater, pia mater and spinal root ganglion is present over here. Whereas when we talk about the foramen transversarium, there is a mnemonic that is V2, that is vertebral artery, vertebral vein and spinal nerves are present over here, okay. Now you can see that the prominent part, or you can identify how you are going to identify the C2 vertebrae. Here you can see the prominent part or the odontoid process of the C2 vertebrae. This is odontoid process articulates with the C1 in such a way that you can move your head in a no movement or rotatory movement is possible over here. A scenario can be given to you in the exam that during the rotatory movement or side to side movement or no movement, which joint has been used? You can say atlanto-axial joint has been used. Whereas in the yes or the nodding movement, atlanto-occipital joint, which is forming between the C1 and the occipital condyle of the skull, this joint has been used, okay, or it can be asked to you in the OSPI or Viva exam. Now come back to the C2 vertebrae. This is the odontoid process. This is the body. These are the pedicle and these two are the lamina forming the spinous process, which is bifid in nature. This is the superior articular facet and this is the inferior articular facet. This is the body, okay. This is the body. You can see the body over here, okay. Now the other this is how they are going to articulate in such a way, okay. Now I am going to talk about the typical vertebrae. When now in some books this is C1, C7 is also considered to be the C7 is also considered to be atypical because of the difference of the spinous process, because the spinous process is present in a different way. This is a typical vertebrae. You can see the difference between these two spinous process. This spinous process is short and this is like protuberance part, and in the nape of the neck you can feel the C7 vertebrae, and so it is considered as an atypical vertebrae, in which you can see the body, and this is the superior articular facet and this is the inferior articular facet. Okay, this is the foramen transversarium, this is the body. And now how you are going to say this is the anterior part and which one is posterior part? In the anterior part the body is going to be like this part is like there is certain protuberance, or you can see a crest like structure. This is known as uncus, or it is known as uncinate process of the body. Okay, this is forming the vertebral column. Pedicle and lamina are going to form the vertebral column. Okay, now this is how I am going to identify the anterior and posterior in this vertebrae. How we were identifying? I have already told you that the superior articular facet is concave, and you can see the odontoid facet is present over here. So you can say this is the superior part and this one is the anterior part because it is shorter in nature. Now talk about the typical vertebrae. The rest two vertebrae are same and we are going to follow the same path. This is the uncinate uncus and uncinate process or the body. This is the anterior root. This is posterior root, costo-transverse bar, foramen transversarium or transverse foramen. This is superior articular facet. This is the pedicle. These two are the pedicle. These two are lamina forming the spinous process, which is bifid in nature. And these are the posterior articular facet. And this is the body. That's it.